Please stay tuned and subscribe.
Everything I be some more cover shonko edibe jumedie so farm medri na health segment and home komo twetwen na me ne oba be twetwen no pay wonim say na wotwe bia ye to ye boase ehwehwem epa bibi e fa pomode ho nsem a ebeboa edindie eni sua hu no aboa me nyina ye nye chefa na ye de aboye ho ban yetime de ye nkwa amen me Dr. Manso ofie ha ne ye nkomo twetwen ye be kasafa food and drug interaction ye benum adru a ye kase bi adidi ansa no wanu medro ho nsem no ensem bebre ye fa no simple sa but there is more to it and the doctor will fear how beto no bo ase na wa chichi mommy atiasi doctor akwa bibia oboko de food and drug interaction no a very good discussion say be ne pa ye we bi mo hono ma aduro be wo kase wo menom anya hwe ma menom ne sa onidi and ye beka ho asem nyina but answer no fa ye shase na fa yetu
okay food and drug interaction and the food and because the food and food drug and drug interaction there were different ways that you bit me because interactions na happen and then ye beka for food and drug interaction since normally no kwa to draw when you look at the leaflets na nkasa it mostly talk about drug and drug interaction but but about drug and food interaction now most of the information is scarce because you ensure that any easily access to these information and now you were food and as a drug and herb interaction so me and son you were drug to drug interaction you were drug to food interaction and you were drug to herb interaction because of that such a broad topic and then by drug to food interaction
okay
now the entity who here and say so wo hwe okwakoto adru na akọ pharmacy na bia wo je box no yema box no na bia wo obi a be hwe leaflets na me one of them me hwe leaflets no this hwe leaflets na mostly the information na wo so no e ka kire say okay adru we emfa nom alcohol and let's say bema effect na eden are different
emfa nom milk
e
be quite more against of soy products near there
no ana wo kano ye wo be brain so ho ma ase insert say omobebu specific list of neoma na any kwansa wo they combine with no the leaflet itself and go too much in detail as to what you need to avoid but the fact that drug to drug interaction any kwansa wo they combine at all no it doesn't mean say drug to food interaction so wo combine no so na less problematic na so wo combine drug to food interaction any kwansa wo combine it can actually ensure say a drone na wo fa no yen can say be a 10 and I say you design a drone. This is actually my specific area so you design a drone near wo be fa no enye noa na wo body nsaka me sure say like ebi omo kai baka maka fa we hu kakra bi say bia ye kase 10 and na wo fa omo kind of bioavailability and only try said the amount a wo benya no e reduce and that is because I wo fa no orally and I wo fa no through the mouth wo live and so ye den a process no e getting into a state near beba bedru no eye near ye pesa wo body near den enya enti adro na nkasa ye mo but ne beba bedru wo body mu ene ye pesa wo ye den unya na food and drug interaction ye wonnuane bi as ye hu say wo fa in combination with drug na emma availability no and bioavailability no
esote kra
it does say esote
and e be increasing
no and now say another a problem in so say e betimi ama adro na nkasa no enye adwuma. And there are so many things that are affecting them because and then me person me bobo specific in the area of the for example hypertension or more asthma or more breathing air problem you were different or more epilepsy so specific in now you dema or more fan because me kasi me group na enye no enye accurate and we have to mention them individually to make sure say side drawway and fanfa way side drawway and fanfa way. And a drobin so on my far, what the fed a food beans so the way I absorb no absorb a row system ni mana say a p. Intisa and near say and intimiate day and I were drobin so okofana now side the fed bia. Say initially I cast a draw side effects near your headache.
it will be severe.
Or headache or side effects, no. It be even more than sometimes what is even written on the leaflets, no. Into the fact said drug to food interaction, and see a consider and say it can actually have the same problems to say drug to drug interaction. Now, you mentioned. Okay, so you started with one of the main fruits. Your name say, to be honest, this is a fruit I can say very common about when it comes to drug. We'll take it dragger. A grapefruit. Me sure say what say.
Yeah, grape crano. Matter say even about 1 month more. Any kind so take it grape.
There are certain fruits bia omokasa okay tobo with these things, and sometimes it depends the content na it could be say bia like for example vitamins no your ba could be specifically you make sure say even in the first 3 months no any kind say we take it, and that's depending on a kind of say fruit crowd off and the amount what okay you can't grapefruit for so many drugs no grapefruit you can't trust say stay away from it. One of them me bobo din nti mpacho say wo fie na bia
wo send no bia wo no ma financial so so wa hu se say de ayi4 de ne ye ma wo hypertension. There was a time ye ma mo fa wo nro and ye say be and this say nti misro wo yo bi ada aduro so a anopa ye ka say ya fa wo nro no ne hwe so nti o ya na de compare no hu say wo say otwe ho free fruit we mo ani nuane bia ene ne clash.
Okay, so grapefruit juice no ye hu ya ne say ne sa wo fa hypertension drug where your friend of felodipine now felodipine and only a hypertensive drug you demand to reduce our blood pressure but often in combination with grapefruit na nkasa grapefruit juice na etimi ma quantity na e wosa edronim no e costro more into blood pressure drop immediately into honum sa na be ma side effects so ayeden adoso
eni so betimi
abriwo na like one nkasa no wonye stable into obi one more say oh me fair draw ya the way ma me ho no me pese me den me fa biem nti e say o hwese bia wo yo bia we ni just grapefruit juice na say even the actual fruit grapefruit na watch ho every ho and say ka say en fa crowd but the time frame over said no stay away from it. Another one and so cyclosporin na we for omo autoimmune diseases no and I say because people no when organ transplant the man say and suppressing immune system no na ye hu say offer cyclosporin no in combination with grapefruit no so na and also e cause to say sa edro no
suppression no suppressing more
yes a suppressing more na suppressing more na no one akana say suppressing too much that means that you are now becoming prone to infections. Because you nim level ye the amount say drew say but what in combination with grapefruit no ebe mana yeden abaform too much. And almost so omofa anticonvulsant medication no. Me anticonvulsant medication na epilepsy
for no
drug no. And also you say stay away from grapefruit at least between 1 to 2 hours no and so making sure say fat grapefruit so wo fair no. Okay, you call high blood pressure so ankasa specifically so wo fear now was celiprolol
and only ka wonno ne ho a eno ni bi na obobo no we hypertension form monfa mu no na monhwe de obobo so yi se wo hu ebi wo wonno no ma enuane ne enuaba e wo se otwe ho firi ho kakra na obobo so no.
Yeah, well, said way celiprolol. Since the last time that make up for hypertension, can law now. It's to do with hypertension mostly. Into yenim say orange juice. Wadi bi my friend hesperidin. Hesperidin orange juice no. It actually make sure say sa edro na wo fa no. Quantity say unya no unya. Into where I say grapefruit for the different medication na can no. And my quantity no unya more no. We no orange juice no sa hesperidin no. And my sa celiprolol edrono celiprolol no. And my absorption
ecofom. Ti ebema o hypertension level no akosoro.
It was true exactly. Inti akoye say enye adwuma yi.
Yeah.
The way I say yeah adwuma no enye adwuma. Into orange juice and celiprolol no. Yen try see a bad day. You stay away from it. Okay, cholesterol. You name say and this is also one of the tricks. So we feel maybe cholesterol medication I ended with statin. Can actually is actually called statin, but where your brand name, your friend is simvastatin, your freebie parafastatin, your freebie fluvastatin. Tinina ended with statin. It's easier for us to remember the names. Maybe a last name na. Into where your anti-cholesterol medication. Now, sa cholesterol drug, obviously making sure say fat content near them reduce. Yes. Now, what you say, so far enuane a containing high fiber. Emma sa ndro no adwuma na eye no so ye den e ba form. Na yen nyina nim say high fiber a good maya, a very good.
So everyone will ought to.
A good maya as you make sure say enuane a ye di mu nyina no e bi den e wom actually most of enuane ye di no e wom. But in this case no so wo fa starting medication making sure say within that time period no was stay away from enuane a high fiber content. Rainy grapefruit na
orange.
No. Actually, it's slightly different from orange. In some of the communication and confusion. Grapefruit na different from orange. In I can't grapefruit there, and I can't orange there. Now where blood thinner. And only a warfarin. Now this is specifically for omoa omenyini kakra. And sa warfarin ye the treaty is a wunyini no na umoja no ye viscous. E trese ye thick. And most of the time no say yeah, ma almost some medication. Warfarin can actually be one of them. One said to me injecting the whole fear. Say be a uhia and ma omoja no ye thin. Sana form clots and bam because sa strokes nomne ya bebre na omoye no. But warfarin na ye the amount again ye the quantity amawa ye nim say moja na thinness na say drew sa level way. Say ye too much e betimi ama say bia me nantena mensabo way na e twaka kra. Moja na e beba tatata no esuntwa. Because moja na is so thin, intiminya line and clotto. Because warfarin is supposed to prevent clotting. And I say these people cramp on say be more 90, maybe more baby kobo baby inside moja betu more inside a bra then. One cause I say start to feel like who you dizzy. Into sa warfarin no say the quantity the mine no a very very important. Say be making sure say Embroso. Now, near you say when they say udi cooked onions it actually increase the activity of warfarin. And it makes sure our blood na even thinner than what it's supposed to be. And I said who said cranberry juice. Me and some cranberry juice because they're very healthy. Especially for the blood and very good. But cranberry juice in combination with warfarin and so you say who say
and also blood near thinner.
And my blood na much thinner. And again, who fear nebia unim said this is mainly for elderly people because I'm not tired and affected why the mawomo. So who fear now use warfarin injection and make sure say oh fa warfarin na cooked onion, any cranberry juice, no, within the time frame now. Antibiotics. Antibiotics. Okay. Mami wrap up quickly. So antibiotics in combination with milk, yes, it should be avoided because it reduces the effectiveness of the antibiotic. And last 2 weeks ago, we talked about say antibiotics effectiveness need reduce. So I might me creating more super bugs. Yeah, discussing. You know, into again, ciprofloxacin, it will fear, or tetracycline, it will fear. I think that those two main ones. No, try so about avoid milk in general. Last one, make a last one, and last one. Okay. So is it your hospital and that's actually in hospital I dear younger see to me for your honor painkillers me am a fabi and we don't need prescription for that now analgesic and I say be antipyretics you used to say you be treating mild and moderate pain now you who say containing pectin. Saying you are is like peach, oranges, grapefruits, and also apricots, even lemons, crampono, and only delay the amount of actually it delayed the effect of acetaminophen, which is paracetamol. And it is the containing peptin and paracetamol specifically. Okay. I see a try see about avoid. But
effective,
a reduce the a delay
the process I was say a year jumano
into betimi afa na be kind of say okay within 30 minutes they say kick in 30 minutes is not kicking in
no
for what's that for so it's actually helping you to take more drugs whereas say yeah it has nothing to do with that but more to do with the fact that what fun in combination with pectin and said the in said and only day we always have to take it with food. So this is non-steroid anti-inflammatory drugs. No? So we are talking about ibuprofen, naproxen, ketoprophens. We need irritated stomach. No? So we always have to make sure, say, you're better with food and not some milk.
Yeah.
Last one, bronchodilators. Now this one is it's actually quite severe because this is in relation to omuhia inhalers to make sure, say,
more breathing problems, asthmatic patients. No?
Yes. Who say high fat meals increase the amount of some of the drugs no or more effort. Now some of these drugs near thiophyllene for example say if you take a high amount of high fat it causes increase in that activity sad drug nangasa activity ma running through all of this very quickly, but I hope say bits and pieces.
Yeah.
And I think that if even Cram say utimi a share over now, betimi I go back. Say be na won run ni wo ho a betimi I go back
quick one, Mami bisa we food and drug interaction. No, I think it's very 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 necessary. Also pempi you can be say so ufa cashew a untimi fa milk. Sa adene no kwe.
Yes, there one and no bebre ho no for example even in a cashew and milk products no mostly no it can be say a form of complexes and I say agglutinated and that means to say the effect and I say to me more side effects to me a cause to be body more any quantity to me a cause so and I remember say in catsia and I say nut sankas and not even just cashew a very common for nobe brains so say so to me avoid it into those things no you try say you better say don't take them in combination more to prevent say a drone about body more normally a drone about body more a look for proteins be our body more now some proteins it's me binded to a drone into so what our proteins no body more binded to a drone and yeah sometimes it's me binded to be a man effect near them too strong sometimes it's me binded to be a what adverse reaction cramp or body more into there are so many interactions that it's me causing.
All right, Dr. Manso, thank you very much for any drug and food interaction watch it mu ameyati asi no bi wo ha fa ya na enye hu nuane na ya edi nuane bi wo ho ansem fata se ye fa nu bi a ye ma no eba ye didi mu to wacheche ni so fa kwanya we so na read more online so ebia na ya more yare so ebia na ya nka we yi but ye bie wani am wo hu se ye wo bibisa ho ye bie wani am wo hu se ye wo se enu bi a wo fa bia na aduane a e go with any aduane a en go with nti ya ajo ho bre na read more e wo online na yintimi hwe ye ho so ye
no bon case ana story about Ghana about artists bibia open social life this all shede UNIDEK TV why should be a we jam she metiko you see me obeti boom